For more details, check us out at youngsrvcenters.com.
Welcome back, everyone. It is Colon Cancer Awareness Month, and it is time to potentially save lives. Here's Jeff Smith in touch this morning.
Thanks for joining us once again here on In Touch. Your health is our focus this week. Want to talk about colorectal cancer, specifically early detection. That is our early focus here with Dr. Eilynn Sipe. She is a ProMedica surgeon, colorectal surgeon there. Thank you so much for spending some time with us. Why is early detection so important? And I want to preface this by talking about something we showed our viewers earlier this week, that being a push by musician, actor Harry Connick Jr. coming out, talking about his wife getting early detection for breast cancer, but this time really putting the focus on colon cancer. Why with colon cancer is early detection important?
Colon cancer, it's incredibly important to have early detection because colon cancer typically starts out as a small growth inside of your colon called a polyp. Those polyps grow very slowly and eventually turn into colon cancer. So if we find polyps, we remove those and actually can prevent the cancer from ever happening. So
you were telling me before we started here today that over the course of time, early detection, the formation could take 10 years, did you say?
Yes, on average, a colon polyp to turn into a colon cancer takes 10 years. There are certain exceptions for that, but that is the reason why American Cancer Society guideline would be if you have a colonoscopy and your doctor tells you it's normal, the next one would not be due back until 10 years unless you have a family history of colon cancer, develop new symptoms, or have other specific genetic syndromes.
And we were talking about this being the second leading cause of death, men and women right now?
It is. It's the second leading cause of cancer-related death in the United States.
Yeah.
But we have seen a significant decrease in that death rate, and every year it's expected over 150,000 Americans will be diagnosed.
So people sitting there at home, let's talk specifically our next topic, that being the warning signs and the symptoms out there. Once again, talking to Dr. Eilynn Sipe. She is a colorectal surgeon with ProMedica Physicians. Warning signs, symptoms. What are we talking about here?
Sure. Warning signs, the thing that's most concerning is a lot of times it's completely asymptomatic. So I have patients coming in every day and they say, I'm perfectly healthy, I run, I exercise, I'm a vegetarian, I don't need to have this test. But really, everyone should be tested, and so one of the biggest risk factors or signs would just be time on this earth. So starting at age 50, we recommend screening. Other more concerning symptoms would be rectal bleeding, changes in bowel movements, stomach pain, cramping, unexplained weight loss, or if your doctor tells you that you're anemic.
You talk about lifestyle a little bit, and you've got those people who are out there who are kind of shy away from even a general practice visit occasionally from their general practitioner, but you could be healthy, you could eat great, and this could still pop up.
That's absolutely true. I have patients all the time that they come in, and actually I had one in particular, she was a wellness director. Everything she did for a living was promoting doing the right things, and then when she said she was diagnosed with colon cancer, she was actually embarrassed to go to work and tell people she had it. But it's different, you know, than lung cancer where we think of smoking, you know, directly related to it and things such as that. With colon cancer, it really affects everyone. It can be so unexpected.
Let's talk specifically about the treatment methods out there as we go to our next topic. Talk about the screening process before we get to the treatment specifically and what somebody has to go through in order to get this test done.
Sure. So there are several screening processes that are accepted. One, you can do a simple yearly fecal occult blood test. Other screening process, you can do virtual colonography and things, but if any of those are positive, then the next step, or what we call the gold standard, is a colonoscopy. So that's what most people are familiar with. To have a colonoscopy the day before, you have to do a clean out or prep, laxatives that you take. They're so much better than they were in the past. You don't have to drink a big gallon of anything salty. There's no enemas you typically have to give yourself. So now there are some preps that are even just pills or lower volume.
We were also talking about insurance as far as that being, it's kind of a well checkup. So a lot, you were saying it's covered a lot of times.
Generally, it should be covered as preventative health.
Yeah. As far as the treatment methods going forward, what are we talking about?
Sure. If someone is diagnosed with colon cancer, then the general treatment would be surgery. And if we find colon cancer early, then over 90% of cases are cured by the surgery alone. If it's a more advanced tumor that has spread to either lymph nodes or other organs, then they need chemotherapy, and looking specifically at rectal cancer, there also may be the addition of radiation therapy.
But that's why we're putting the call out here more than ever before, talking about the early detection and getting in and getting checked.
Exactly.
Doctor, thank you so much. Good to talk to you. Appreciate it. We switch the board. You are now more in touch.
Okay, thank you.
All right, Jeff, thank you. And that'll do it for this edition of Conklin & Company. Make it a great